the $5.6 trillion blind spot. Why American healthcare can't see its biggest problem. American healthcare is drowning in costs over $5.6 trillion annually. Yet we remain fixated on secondary issues while ignoring the core problem. Like the infamous psychological experiment where participants missed a gorilla walking across the screen while counting basketball passes, we're so focused on metrics like premiums and subsidies that we've overlooked the elephant, or rather, the gorilla, in the room. This isn't just an economic issue. It's a systemic failure impacting everyone, from Washington policymakers to rural hospital patients. The relentless rise in costs threatens businesses, destabilizes government budgets, and accelerates job displacement. Ignoring this crisis is no longer an option. The crisis in Washington, Band-Aids on a broken system. Congress debates extending Affordable Care Act, ACA, subsidies and Medicaid funding, while the underlying cost of care remains unchecked. Reducing the cost gap between U.S. and Swiss healthcare, where spending is nearly $5,000 per person lower with better outcomes, could save $700 billion annually. Yet the focus remains on short-term fixes rather than structural reform. As federal funding dwindles and eligibility changes loom, millions face losing coverage. Hospitals respond by charging private insurers exorbitant rates, pushing costs onto employers and workers. The cycle continues, with no real solution in sight. Corporate America's illusion, cutting costs without addressing the root cause. Businesses raise deductibles and narrow provider networks, hoping to control expenses. But these measures are temporary. Without addressing the underlying cost of care, premiums will continue to rise, straining both employers and employees. The average family health coverage will soon exceed $30,000 annually, with workers bearing a significant portion of the burden. This limits wage growth, hinders hiring, and stifles innovation. The workforce under pressure. Automation as a last resort. As medical costs spiral, companies turn to automation and AI to cut labor expenses. Amazon's recent layoffs and plans to replace warehouse workers with robotics are just the beginning. Millions of jobs are at risk, further straining government budgets as displaced workers turn to Medicaid and subsidized plans. The problem isn't insurance, it's the unsustainable cost of medical care. Unless costs are drastically reduced, the impact will reverberate throughout society. Rural hospitals on the brink. A symptom of a broken system, over 150 rural hospitals have closed in the past 2 decades, and another 700 are at risk. Emergency grants and temporary bailouts delay the inevitable, but they don't address the fundamental issue: high fixed costs and low patient volumes. Survival requires consolidation, regionalization, and a shift towards emergency and urgent care hubs supported by telemedicine. Painful sacrifices are necessary, but ignoring the problem will only accelerate the collapse. 3 solutions for a sustainable future. Fixing American healthcare requires structural reform, not incremental tweaks. 3 proven strategies could save $700 billion annually. Leaner hospital footprint. Consolidate low-volume facilities, eliminate redundant programs, and create regional centers of excellence. Transition small rural hospitals into 24-hour emergency hubs supported by telemedicine. Preventative care focus. Control chronic disease through expanded primary care, government drug price negotiation, and AI-powered home monitoring. Prevent complications before they require expensive interventions. Value-based payment. Shift from fee-for-service to capitation, rewarding providers for keeping patients healthy, not just treating them when they get sick. Incentivize prevention, early intervention, and efficient care delivery. The time for action is now. No single group can fix this alone. Elected officials, businesses, insurers, clinicians, and patients must overcome their inattentional blindness and confront the $5.6 trillion gorilla. The longer we ignore the problem, the worse things will become. The question isn't if we can fix American healthcare, but when we will finally recognize the elephant, or rather, the gorilla, in the room.